Hello, I'm in Charlottesville, Virginia. My patient just got out of surgery. I just got the call on the report from the surgeon. It went great. She had an endoscopic brow lift, deep plane face and neck lift, CO2 laser in a few different areas, and fat transfer to some different areas in her face. So I'm just really, this woman is great. I know I say it, my family makes fun of me because I'm like, I love this patient. I'm like, I really do. So anyways, my message today, and I know this isn't going to be a problem with this patient, but if I were to give you one thing that makes or breaks a recovery, it's how much someone eats after surgery. So, and I fly around the country and fly around the world actually, and recover patients after mostly facelifts these days. And this is the defining thing that makes or breaks it. I feel like when patients don't eat enough, it just unleashes a cascade of negative events, and it's really like hard to get it back and just get back on track. And so I really feel like the women I work with these days really buy into this. And so I feel like, the longer and longer I do this, people do better and better because they kind of know when they hire me, they know what they're getting into. They buy into the plan and they're willing to eat even if they're not hungry. And I don't know why people aren't hungry. I wasn't even hungry after my rhinoplasty, so I get it. And I was like, this is weird. But you got to really make sure small, soft, facelift friendly, right? Non-spicy, non-dairy, because dairy can cause nausea. This patient is actually allergic to gluten and dairy, so we're avoiding that anyways, which is easy to do. So I just made her a big pot of gluten-free chicken noodle soup, and then some homemade applesauce, and then we've got just tons of other things. I went and bought a blender so we could do smoothies. I'm even gonna blend her soup just for the first few days, just so it just makes it really easy. So because after surgery, most people, especially if you have general anesthesia, the biggest complaint is actually a sore throat. And so the really, really cold applesauce feels great. And then of course, not having to chew the food is always helpful. So if you're following along and you're having any kind of surgery, please make sure whoever is taking care of you got to tell them these things, because you're watching all these videos and following all the surgeons, but whoever's helping you might not be as into all this as you are. So you really want to make sure you're sending them this video. If you bought one of my ebooks, print them a copy of it and have them read it, even if they're reading it while you're in surgery, so they know what to expect, what's most important, how to show up for you. So thank you so much for following along. My next patient, the one after this, is also here in Charlottesville. So this is going to be fun, 2 back to back.